want to know whether a machine comes either when it is closed bore or open bore.
Yes, depending on the specifications that you the owner of the facility want, depending on which kind of exams are you going to perform. So you would either purchase an open door, or you can purchase a closed door. Because we see that these ones have different magnets. We saw mostly the open bore has permanent magnets, and then the closed bore, they normally have the superconducting magnets. So of course you have to specify what do you want, or maybe if you might not specify, but maybe what particular patients are you going to work on. But in most cases, like the way members have explained, when it comes to the closed bore, you do a variety of these particular exams because of the high field strength. So in most people are buying, they go for, I think in Uganda I've had one center that has an open bore. I don't really know the name of the hospital, but I know where it is located. So even when you ask them how many patients they can receive on a daily basis, still there will be very few compared to the open bore. All right. Thank you all for your submission. Let's continue. I was asking you to read about the upright MRI. The upright MRI, you can position a patient the way you want depending on the exam you're going to do. Like for example, if you're going to do the shoulder, you can make the patient to sit, okay, and put the shoulder in position, and the one you want to image. So if it is the foot, you can always, it's the position that only that particular foot, like the patient really doesn't have to lie down. Those are called the upright MRI. So they are also in shape of open bore, though their opening is a little bit not that very big as these other open bore magnets. So try to read about the upright. Please, everything I tell you to read about is examinable. Let's look at the RF coils. We looked at the gradient coils, we looked at the shimming coils, and then we also looked at the shielding coils. So the gradient coils, we said that these ones normally vary the magnetic field strength, okay, such that they can help you locate your area of interest, like you localize the signal. Where do you specifically want to, your particular signal you're going to use in the formation of the image, like where is it supposed to come from, okay? And we can do that by using the gradient. We saw that there are 3, X, Y, and Z. So this one can be varied depending on what the radiologist wants, okay? Depending on the view. If you want the X, choose the X gradient. Y, if you want the oblique, you can choose 2 or the whole set of magnets, okay? Meaning that in MRI, we can acquire all views, unlike when it comes to CT. In CT, we see that we only get the axial images, but maybe later on we can process to have other types of images. But what we acquire, they are axial. But when it comes to the MRI, we can get all types of views. Okay, so you just need to change the gradient coils. RF coils, these ones we said they behave as antennas. They send the radio frequency waves and also receive the magnetic resonance signal. Okay, so when we remember, we said that after attaining the net magnetic vector, then we are supposed to send the radio frequency waves such that they can cause resonance. And I said that initially, when the net magnetic vector is attained, it is in the longitudinal direction. That is the same direction as the external magnetic field. So what happens when we apply the radio frequency waves? These waves, we said that they give energy to these net magnetic vectors that are within the longitudinal direction. And then when they give them energy, depending on the sequence, which you look at when it comes to, anytime we'll hit about the sequencing and later most of the things you will study them when it comes to MRI techniques, CT and MRI. So when the radio frequency waves come and interact with a net magnetic vector, RF waves, they are carrying energy. So meaning that they are going to energize this particular net magnetic vector, and they are also set in motion. And if they are set in motion, there is a change in the magnetic flux. And we know that if there is any change in the magnetic flux that is attained, then we expect a certain signal to be ejected. So that EMF or signal that is ejected out of the net magnetic vector is what we call the is what we call the MRI signal. And then the amount of the signal is dependent upon how much change in the magnetic flux has taken place. If the change is less, then also the MRI signal that is going to be induced is also going to be less. If it is a lot, then it will be a lot. So what happens? I was saying that when resonance takes place, or when the RF coils come and interact with a net magnetic vector, only the vectors or the nuclei that are precessing at the Larmor frequency are the ones that are going to resonate. So when resonance takes place, these net magnetic vectors or nuclei are going to flip from the longitudinal direction to the transverse direction, meaning that now they have obtained energy, okay, from the RF waves. On attaining energy, they can no longer handle, or they are now more energetic compared to the external magnetic field. So they flip to the transverse direction. And the angle through which these net magnetic vectors or nuclei flip in, we call it the flip angle. So now here I'm showing you that it is within the transverse direction, but depending on the amount of energy that these nuclei have attained will determine the flip angle. If they get less energy, then the flip angle is also going to be small. And if they get more energy, then the flip angle is going to be big. And also this is dependent upon the sequencing processes that are taking place, okay? Or the sequencing purposes that are being used. So what happens? In that, if we now switch off the radio frequency waves, then these nuclei are going now to go back into the longitudinal direction. In the process of going back, now that is when the MRI signal is induced, because now the the tissue that had attained energy have now lost all the energy. Okay, so that is called like the spin lattice, like the nuclei that attained energy are going now to lose the particular energy they had acquired. That the tissue that now had acquired, remember, the nuclei that I'm talking about are those ones that they make up the particular tissue we are scanning. Like, for example, if I'm scanning the brain, so if I'm talking about the nuclei, I'm talking about the hydrogen nuclei. So they receive energy and then after lose the energy. So we can call that like the spin lattice relaxation, whereby the spins or the hydrogen nuclei will give up their energy that they obtained from the RF pulse. Okay, so they will emit it, and now that is going to be now that is going to be the MRI signal in that particular area. So, and the time that is taken for this nuclei to lose their energy or to move from the transverse direction back to the longitudinal direction is called the T1 time, or we call it like the relaxation, spin lattice relaxation time, or we can say T1 time. Okay? And then the process by which these longitudinal ones acquire their energy is referred to as the T2. And for it is a spin, because now the original hydrogen, like the original No, the hydrogen nuclides have now attained back their energy. They have gone back in their normal energy corresponding to the external magnetic vector. So that one corresponding to the external MRI. So what happens is that now the longitudinal net magnetic vector regains back its energy, which is directly proportional to the external magnetic field. So the time the longitudinal take to acquire back their energy, we refer it to T2, or we can say the spin relaxation time. Whereas the time taken for these transceivers to lose the energy or to give back the energy they had acquired from the RF waves is referred to the T1, or what we call the spin lattice time. Okay, and the time these nuclei take energy is greater compared to when they are regaining. Okay? So that one, you look at it more when it comes to the imaging part. So what was I trying to explain is that RF coils, they can be transmitters or they can be receivers, or they can be the same. They can both transmit and then at the same time receive, and those ones we call them the transceivers. And because of the receiving and then the sending is why we refer to them as antennas. So we have various types of RF coils. Some are inbuilt within the MRI setup. Now, like for example, this whole body coil, you find that it is within the MRI. Okay, so for it covers the entire body. Then we have a second type, we call it the surface coil. These ones, they are placed on top of the body. Okay, so if you're going to do the chest, you can see the surface coil is being placed on the area of interest. So you can see that the surface coils, they will receive more signal compared to the whole body, because these ones, you can see that they are just attached at the area of interest, whereas the whole body coil, they have a distance away from the area of interest. Then we have the volume coils. The volume coils, these are coils that are dedicated for particular areas. Like for example, the brain coil, it is referred to as a volume coil. Okay, then you have that one dedicated for the knee, then coil set into the examination table to scan the spine, meaning that for it is dedicated for the spine only, and they are located within the body. So let's look at these different types. So resonance being MRI imaging is done by RF and calculated by the Larmor equation. So in order to provide an image, the RF must be transmitted at a resonant frequency of the hydrogen. And that resonant frequency is what we call the Larmor frequency. So you send a frequency, or the radio frequency should move at a frequency that is equal to the frequency at which the hydrogen nuclei are spinning. And then that's when we shall have resonance. And when we don't have resonance taking place, then we can never have the MRI signal induced. So we have transmitters, coils. The transmitter sends an RF pulse that transfers the net magnetic vector from a position prior to the BO to an orientation at right angles to BO. That is when they get like 90% of the RF pulse. So the net magnetic vector is going to be converted to the transverse direction. And we got to know why. It's because now they have attained energy and resonance has taken place. So they have to move. Then RF transmitter coils in most cases are the body coil, usually located within the bar of the magnet itself. These only transmit. Then a head coil, which is coupled to a receiver coil. So meaning that if you're using a body coil, this one is, in most cases, it is a transmitter. So it will transmit the RF coil, but there will be another coil that is available to pick up that particular signal. Then receiver coils, if a loop of wire is exposed to an oscillating field, a current is induced in it. And what is causing the oscillation is the RF pulse. Then the induced current is now going to be the MRI signal, and resulting voltage constitutes the MRI signal. So the receiver coils adequately detect the MRI signal. Okay, so the transmitter brings the RF, the receiver coils are available to pick up that particular signal that is being induced because of the change in the magnetic flux. So we have types. We have the volume coils, or what we call the bird cage coils, because they are designed in such a way that they cover a particular area. We have the surface coil, phased coil, the solenoid coil, helmholtz pair, but the most common ones, I'm going to talk about only the volume, surface, and phased. I'll ask you to read about the solenoid coil and the helmholtz pair. So the Helmholtz pair are like the gradient coils. You saw how I was explaining the gradient coils within the z-axis. So that's how also these RF coils are being arranged. So you can try to read about them. So the volume coils, we've said that they cover specific areas. And in most cases, the volume coils are transceivers. They can transmit and then they can receive. When we say that these are both transmitters, they both transmit and so they are called transmitters, it doesn't mean that all the volume coils you're going to find are going to be like that. No. Some can be transceivers, whereas others can, depending on the manufacturer. Okay? So you know that different manufacturers will have different properties. So you might find that, yeah, but in most cases, the volume coils are transceivers. So these ones, they encompasses the entire anatomy. So you can see like here, this is a volume coil. Then you can also see here for the hands. So these can be for head extremity or total body imaging, like the way we saw the body coil. So that one is for total imaging, and in most cases that one is a transceiver. So because of their large size, they produce images with low signal to noise ratio than other types of coils. They are big, okay? So you see here, okay, behind the head is in contact with a coil, but when you look up, there is space from the body organ to the coil, okay? So in between here, okay, the signal is going to be produced, but in between here, there is noise. So there will be an addition or a sum up of the noise plus the signal. So in the end, the signal to noise ratio is going to be lower. And the fact that this coil is not really in contact with the body organ, you find that a lot of signal is going to be lost. Maybe some of the signal that is weak cannot make it up to the coils to be picked up. So it is going to be lost on the way. So that affects the signal to noise ratio. And we say that one of the contributors to the quality of images produced in any modalities is dependent upon the signal. If your signal is weak, even your final image is going to be poor. Okay? And we know that if the signal to noise ratio is low, then you have to adjust on the time you're going to take while scanning that particular patient. So those are the volume coils. So in order to overcome the problem of the volume coil, then we always opt for the surface coils. These coils are used to improve the signal to noise ratio when imaging structures near the surface of the patient. Of course, not all organs we can use the surface coils. Like for example, we cannot use the surface coils on the head. Okay, so for some reasons, we just have to bear. But where we can avoid, now like if you're going to do a lumbar spine, why would you use a total body coil? Okay, I know most facilities, they cannot afford these particular coils, so they just go with what is available in the machine. But the image quality that comes out is always poor. Okay. And then you might even find that you really sometimes have to repeat the exam. Okay. Yeah, there are facilities who don't have these outside coils and they are only relying on the internal coil, which is not good. So the nearer the coil is situated near the structure and examination, the greater the signal to noise ratio, and then the coil is close to the signal emitting anatomy, just as you can see. Okay, so I think this one you can even relate it to the high frequency transducers whose pulses don't really, okay, yeah, no, we can compare it with the intracavity transducers, which get closer to the area of interest. Okay, so since they are closer, so they just need a little penetration, and then you receive the signal as close as possible. So the outcome is always going to be of a good resolution. So small and shaped such that they can easily be placed near the anatomy with little or no discomfort to the patient. Those are the surface coils, so they can be put directly on the area of interest. Then we have the phased array. Even the phased array, they are put on the area of interest. But these ones consist of multiple coils and receivers whose individual signals are combined to create one image with improved signal-to-noise ratio and increased coverage. So the phased array don't just give us a good signal, but they also increase on the field of view, like the area you're covering. So meaning that they are mainly used when we are scanning bigger areas, or if your field of view is a little bit bigger. So for these ones, they have multiple like individual coils. Like for example, this is a coil, 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 and also all these ones that are branching off are coils. So the signal, so every coil you see here picks up the signal from the area and then send it to this middle part. Okay, so all the signal is going to be combined here and sent for processing. And even these ones are also independent coils. So the first, they have individual coils that are going to give us individual signals, but these signals are going to be combined and then produced as a single signal. Usually up to 4 coils and receivers are grouped together to increase either longitudinal coverage, that is the spine imaging, or the uniformity across a whole volume. So you find different phased coils for different body parts. Like for example, the spine, we have the pelvic phased array coil, the breast coil, then the temporomandible joint phased array. So the phased arrays are normally receiver coils and also the surface coils. It's in most cases the volume coils that are transceivers, but these other ones are receiver coils. So what is going to be acting as the transmitter is the total body coil that is inbuilt within the MRI system. We have the patient transportation system. I asked you to read about the solenoid and then the helmatoid coil, and they are also mostly the L motors can be both transceiver. So you can try to read about them, but the commonest you're going to find are going to be those 3. Okay. So even when you go to MRI, if you try to maybe get there, you can always look at these coils. Okay. So you find coils dedicated for the breast, you find coils dedicated for the neck, you find coils maybe dedicated for the extremities, for the head. So you find different number of coils or various coils depending on what the facility can afford. Then we have the patient transportation system. This is just a coach, like where the patient lies. So the coach is hydraulically or mechanically driven to lift the patient to the level of bore and slide them into the magnet. So meaning that this coach should be able to move towards and away and then also down. Put down such that the patient can be able to lie on here and then raised up, put inside the bore and then outside. So achieved by pedals or buttons that move the coach up and down, in and out of the bore. Table should be comfortable to the patient and allow for the attachment of coils. Of course, yeah, the coil should be able to, like, if maybe you're wrapping it around the patient's chest, you should have somewhere you can attach those extra, like the way you saw. Then the operator interface. The operator interface, we shall really look at it when we are looking at CT because they are the same. It's just that you should have a computer system. This computer system is the one that receives the signal that was picked up by receiver coils. Okay, so of course you expect some connections from the MRI machine towards the operator's console. So where there are different consoles inside where the operator sits. So you find console for all. Consoles are just like displays where you enter the patient's data. Enter patient's data. You know what you have to enter the patient's data, the name, what, the referring doctor, all that. Then also there should be another one that receives the image, or that very one where we set the enter in the patient's data. We can now select what view do we want, which particular body organ are we going to scan, is it with contrast or without contrast. Okay, so contrast, these are chemicals that are injected to improve on the on the contrast resolution of the patient. Okay, they help in the absorption, they just amplify on the absorption of the signal such that we can have that delineation between the rest of the structures. Okay. For example, if you want to clearly see blood, yeah, from that particular image, now you can select out what do you want. Can you enhance these particular factors? Can you enhance the quality of the image? And later on, maybe you can send to the radiologist for further analysis. But the number of computers or consoles within the MRI, they normally vary depending on what the people can afford. So you might find one computer that they use to do each and everything, and then the rest may be in the radiologist room for reporting. Yeah, an RF processor for Fourier transformations, and then an image processor that takes data from the RF processor to form an image, hard disk drive for storage of raw data, then a power distribution mechanism to distribute and filter. Okay, so you will deeply look up at the MRI image in the imaging. What I didn't take. So MRI image, maybe what we have to talk about is the detail, because it is a 3D image. So normally we look at the smallest structure or the smallest component being a voxel. So this is the entire voxels, and each independent voxel is made up of the protons we talked about, that is of hydrogen protons, and you see they are taking on the fat and then water proton. One thing you should note about MRI, it's very good when it comes to soft tissues as compared to the CT. So if you're asking yourself when should a patient go for a MRI but not a CT? For MRI, not CT, it's more when you are looking at soft tissues. But still, MRI can do the bones. So in cases a patient can afford, they can always, but in most cases, it's the radiologist who recommends what to go for. So if it is more to the soft tissue, muscle, those things, it will be more to the MRI. and then the rest is CT when you are basically looking at the bone. But however, the CT takes on a variety of scanning or conditions compared to the MRI. Okay, what are the risks involved in MRI? Possible reactions due to metals, due to magnets. We know magnets attract metals, so if you have any metal inside your body and then it won't disclose, you can always experience heating. And then loud noises from the machine causing hearing issues. That's why you're given earplugs. Increase in body temperatures during long MRIs because of the MRI. So that these magnets keep on heating. And of course, we are having spinning of these hydrogen atoms within the body. So whenever you expect, where you have motion, you expect heat. Then we have claustrophobia, a morbid fear of being enclosed in confined spaces. People have explained this. You should consult a doctor prior to an MRI if you have implants, artificial joints, high implants, IUD. We know some IUDs, not all of them are ferromagnetic, but some of them are ferromagnetic. Pacemakers, implanted electronic device that takes over the function of the natural cardiac pacemaker. So if you have such, you have to first declare. Then what are the safety measures? Make an appointment such that we don't have a pacemaker or any other contradicted implants. You'll be offered earplugs. Then you're asked to stay still such that you don't cause motion artifacts. Sometimes babies or the elder they were talking about that have the catastrophia effect, they can be given anti-anxiety medication, and some can even be sedated. Imaging, and on here you can add on that for the catastrophic patients they can be referred for further to go for open MRI if it is available. Then carefully screen the patient and anyone else accompanying the patient to the room. Some patients, they refuse to go in those rooms alone. They need somebody to sit somewhere there as they are being worked on. So even the person escorting the patient has to be screened such that you don't have any metallic thing. The ladies, you normally have a lot. So make sure you remove your earrings. You have earrings on your nose, ears, over umbilical cords. No. They are so you always have to remove all those earrings. Don't enter with them. The belts, bras, everything has to be removed. In fact, here they are saying even if they are non-ferrous, they may hit and reduce the image quality. Tattoos, they have to be covered with a full weight cloth for this patient if they can be. There are those that they cannot. So please, people who are taking tattoos, be careful. We might fail to save you. For the best way, because even ATMs, identity cards are supposed to be left. So for the best way to avoid all those things, you ask the patient to always change into the gown, hospital gown, to ensure more safety. Have questions about surgical procedures, metal injury, and pacemakers. Patients and relatives, friends should remove credit cards, loose metal items, keys, and jewelry. When do we choose MRI and OCT? Most likely your referring physicians will be the one to recommend. If you need a more detailed image of your soft tissue, ligaments, organs, your doctor will usually suggest an MRI. And such cases include herniated discs, torn ligaments, soft tissue anomalies. If you need a general diagnostic image of an area like your internal organs, or due to a fracture or head trauma, a CT will always be recommended. And then extensive research has been carried out into whether the magnetic fields and radio waves used in MRI possess biological risk. However, no evidence. And MRI is expensive compared to CT. So not all patients can always afford. However, when you try to, there are certain accidents that have occurred in MRI, whereby there are cases where they were scanning a patient and then maybe the person pushed a bed inside the room, and then this bed was pulled by the MRI, by the magnet into the bore, and this killed the patient. So there are so many cases that accidents that have occurred in MRI, but these are depending on the either bringing a ferrous material in close vicinity with this magnet. You expect such cases. To the patients who don't disclose their surgical procedures and maybe they have metals inserted within, they will also have such effects. The biological risks you can read about if you're really interested in finding out more about MRI when it comes to the safety analysis, is that most of them are about heating, and the heating is coming from the number of hours the patient has really taken under during the exam. So as the exam time increases, also the heating increases. So yeah, those are the most cases you can find around. And then maybe the general accidents. Okay, so you can try to read about them. Somebody's asking, Madam, do implants also comprise of family planning implants? Like, I don't know these family planning implants that Jadeda and Implano. Are they even the family planning? What I know, family planning implants, if they are ferrous, they can still react. Okay, so you have to present your papers, and they do an analysis that these implants are not ferrous. I don't know what Jadere is made up. I don't know what implant. My first time to hear this. Okay, so please, as long as you have any object within your body that is ferrous or magnetic, just know that you have to disclose. Okay, disclose even when, because for you don't know whether it is ferrous or not. So you have to disclose such that your physicians get to know whether it is magnetic, prone, or it is not. Because for you don't know. Can I have questions? So the next modalities we are going to embark on, they use ionizing. So we shall look at the general imaging, general radiography, sorry, or what we call the plain radiography. Then we go for the 3D, that is the CT. No. We first go for fluoroscopy. Then we look at CT lastly.
Is the Larmor frequency constant, or it keeps on changing? Does it keep on changing basing on the magnetic field strength?
Yes, I think we said Larmor frequency is equal to the gyrometric ratio and the external magnetic field, and okay, the magnetic field, because we saw that when we are localizing our signal, we also add on the magnetic field due to the gradient coils. You get it? And then also the nuclides you're dealing with. But anyway, for this example, we are dealing with hydrogen nuclide, so it keeps on changing. However, what you should note is that all these readings will be given by Like you, the radiographer, you can tell, okay? And then you know at what particular radio frequency am I supposed to send. Okay, like the radio waves I'm sending, they should be of which particular frequency. But of course, we know that even the radio waves, they have their own range of frequency and you cannot exceed it. Is that okay? So it keeps on varying depending on the magnetic field strength.
I'd want to ask about the signal to noise ratio. Like I do not understand, like how does it affect like our imaging resolution on board, like the volume and then the other types of coils.
Okay. And when you hear ratio, you're just looking at the signal divided by the noise. So how much signal is being picked up by the system divided by the noise that particular system has picked out. Okay? So you see here, if we divide, anyway, depending, if we divide and then find out, no, if we take 150 and then this is not a ratio, so it's going to be like a 3:1. So you see that the noise, the signal is higher, okay, compared to the noise. But if it was the other way around, noise is higher than the signal. So do you know that the noise is going to suppress the signal that was picked up? So the image is going to be formed from mostly the noise. Okay. So if your image is highly made up of the noise, how can the image quality be good? And the most affected is going to be the spatial resolution. You cannot see the detail of the image. Okay, so in this case, the signal to noise ratio is higher, whereas here the signal to noise ratio is lower. Have I answered you? So meaning that if the system picks up a lot of noise, it covers most of the details that are making up that particular image. So I don't know, the noise, that grayness you always see in the images, can you really resolve the images you want, the tissues you want to analyze? It's like when you're watching TV, us who are still using the analog TVs, radio frequency range, and when you use the electromagnetic spectrum, always these ones have a certain range. I'm not getting the radio, I'm not using radio frequency waves from any other. We are using those ones that are found on the electromagnetic spectrum. The ones on the radio. They can be both intrinsic factors. Actually, one thing you should note that in most cases, when the signal, okay, it's best explainable. The thing I wanted to say, it's more in the city, that if the system picks up less, okay, like the area of interest we are scanning picks up less signal, in most cases the noise is going to, so the noise could be both intrinsic factors or they can be extrinsic. Like some could be directed from the machine, those are the extrinsic ones, and some would be from the patient themselves. You looked at the X-ray tube, that's what we are going to mainly look at. No. I think we shall start with a console. So read about the three major regions or parts of plain radiography. Read about the console, the generator, and then the X-ray tube.